I think what characterizes the Rotterdam Liver Group is possibly related to the fact that Rotterdam is one of the biggest ports in the world, which means that also the hepatologists try to look for the borders of what is currently possible in liver diseases, and that we try to go beyond where nobody has ever been before.
We are dedicated to hepatology. We have the largest transplant program, and we grow in the past 30 years, and that's astonishing and amazing, and that's why I'm still in Rotterdam and not somewhere else. Everything what I want to do is possible here, so the future is here.
I really worked many years in the United States, and I could have stayed there, but I didn't, because I really wanted to come back and be at Erasmus and do my training here and work here as a hepatologist. Because this is the place I wanted to be. This is where I feel that within the Netherlands at least, and within Europe, this is one of the best places to be as a hepatologist.
This department has been at the forefront of viral hepatitis research for many, many years. What makes it very, very special is that we have a very good combination of the clinic and basic research that is done in the laboratory. And I think this combination, this translational research, makes it very, very special, and that's quite unique in the world.
The golden time of our specialization. Why? Because we have treatment, we have diagnostics. It brought money, it brought the common interest from the pharma industry actually. That means new education, that means new colleagues, another funding, and we have the heart of the whole specialization, which is liver transplantation program.
I see a very diverse team, so we are very complementary. We have different topics of interest, we have different personalities, but together we are a superb team.
I used to consider myself as a younger team member, but now I'm not so certain anymore. Somewhere in the middle.
I'm by far the youngest, yeah. Yeah. The majority of them is quite older, so they have a tremendous amount of knowledge that I can profit from.
I'm one of the few doctors within our department working in both hepatology and gastroenterology, and I always have favored the mix of gastroenterology and hepatology. So, and that's maybe one of the reasons I work with much pleasure.
It's my ambition, obviously to become the best hepatologist in the country or in the world. But my focus within that huge ambition is to better translate lab data to clinical application.
So what I think would be fantastic to achieve is if we can do the same as what happened with hepatitis C research, see if my group, my team can cure hepatitis B, or at least find a way to control hepatitis B for all the patients, that it can stop the medication and that we can really, really make a difference there.
One of my main ambitions is to look outside this fantastic institution, to get the knowledge to the patient, to get the patients informed about everything that we can do for them, but also to get the referral physicians informed of what we have here, what we have available for our patients, and at the same time teach my young colleagues to be one day as knowledgeable as some of my esteemed colleagues.
I'm proud. I'm proud of our 6 colleagues who are very eager and very dedicated for working in hepatology. That's what I'm most proud of.
I would summarize it as an institute of passion.